Welcome, folks. Today, we're diving into a fascinating study about protein and muscle synthesis in critically ill patients. It's a topic that has significant implications for how we approach nutritional support in the ICU. I'm eager to get into this. So, what's the core issue this study is addressing? Well, as the study points out, critical illness often leads to rapid muscle wasting, which can then lead to longer hospital stays and poorer recovery. The idea is that providing enough protein could help counteract this muscle loss. International guidelines suggest higher protein intake for these patients, but this study questions whether simply increasing the protein dose is enough. I see. So, the researchers were looking at whether more protein directly translates to more muscle being built? Exactly. They wanted to see if a higher dose of protein, specifically 40 grams, would lead to greater muscle protein synthesis compared to a lower dose of 20 grams in mechanically ventilated, critically ill patients. And how did they go about measuring this muscle protein synthesis? They used a pretty sophisticated technique involving stable isotope amino acids. They infused labeled phenylalanine and tyrosine, and then took repeated blood and muscle tissue samples to track how these amino acids were being incorporated into muscle protein. It's a way to directly measure the rate at which new muscle protein is being synthesized. That sounds quite precise. What were the main findings of the study? Interestingly, they found that there was no significant difference in postprandial muscle protein synthesis rates between the 40-gram and 20-gram groups. Even though the higher protein dose did lead to higher concentrations of leucine and tyrosine in the blood, it didn't translate to more muscle protein being built. That's surprising. So, the extra protein wasn't being used to build more muscle. Why do you think that is? That's where the concept of anabolic resistance comes in. In critical illness, the body's ability to use protein for muscle building seems to be impaired. This could be due to factors like systemic inflammation, insulin resistance, and immobility, which can interfere with the signaling pathways involved in protein synthesis. So, it's not just about the amount of protein, but also about the body's ability to utilize that protein effectively. Precisely. The study suggests that simply increasing the protein dose may not be enough to overcome this anabolic resistance in critically ill patients. It's like trying to fill a leaky bucket. You can pour more water in, but it won't necessarily stay there. I see, interesting. What are the implications of these findings for how we feed critically ill patients? Well, it suggests that we need to be cautious about simply pushing for very high protein intakes without considering whether the body can actually use it. The authors point out that several recent large trials evaluating augmented protein doses in critical illness have failed to show benefits on patient outcomes, and in some cases have even suggested potential harm. Harm? How can higher protein intake be harmful? The authors hypothesize that if the excess protein isn't being used for muscle protein synthesis, it might be used for other purposes, like energy provision, or it could be broken down into toxic byproducts like ammonia and urea, potentially leading to adverse effects. However, they didn't measure these byproducts in this particular study. I got it. So, what were some of the strengths and limitations of this study? A major strength is the use of that stable isotope methodology, which allowed them to directly measure muscle protein synthesis rates. Also, they delivered the protein directly into the small intestine, bypassing potential issues with delayed gastric emptying, which is common in critically ill patients. However, a limitation is that they administered the protein as a bolus rather than as a continuous infusion, which is more typical in clinical practice. Also, the patients were studied relatively early in their ICU stay, so the findings might not apply to the entire duration of critical illness. That makes sense. So, what's the key takeaway from this research? The main takeaway is that simply increasing the enteral protein dose may not be sufficient to overcome anabolic resistance and promote muscle protein synthesis in critically ill patients. Future research should focus on strategies to improve the body's ability to utilize protein rather than just increasing the amount provided. This might involve interventions to reduce inflammation, improve insulin sensitivity, or promote mobility. This has been incredibly insightful. It sounds like there's still a lot to learn about how to best support muscle health in critically ill patients. Absolutely. This study highlights the complexity of the issue and the need for a more nuanced approach to nutritional support in the ICU. Well, that wraps up our discussion on this interesting study. Thanks for tuning in, folks. We hope you found this conversation informative. Until next time, goodbye.